Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pelvic Inflammatory Disease, PID. Introduction. Pelvic Inflammatory Disease is also known as PID. PID is an infection of the female reproductive organs. These organs are needed for a woman to have a baby. PID can lead to many problems, such as infertility. Infertility is when a woman is unable to have a baby. PID is one of the most common causes of infertility. However, it can be prevented. This program will help you understand PID and its causes. It talks about the female reproductive system. It also covers symptoms and treatment of PID. The female reproductive system. The reproductive system is made up of organs that are needed to create children. This section talks about the female reproductive organs. These organs are located in the pelvis. They are found between the urinary bladder and the rectum. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. First, an ovary releases an egg. The egg goes down the fallopian tube to the uterus. It may become fertilized along the way. If a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to grow a lot. The inner layer of the uterus is a special lining. This lining is called the endometrium. It grows and thickens each month. The lining prepares the body for pregnancy. If a woman does not become pregnant, the lining flows out of the body. This is called a menstrual period. Menopause is the time of a woman's life when periods stop. The ovaries no longer make hormones. It usually happens around age 50. As this time gets closer, periods may not happen every month. Periods may be skipped. They may not last as long. The lower part of the uterus is the cervix. The cervix is the passageway to the vagina. The vagina opens to the outside of the body. The opening is found between the urethra and the rectum. The urethra is where urine comes out of the body. The rectum is the last part of the large intestine. Symptoms. Many women don't know they have PID because they don't have any symptoms. For women who have them, symptoms can range from mild to severe. The most common symptom of PID is pain in your lower abdomen. Other symptoms of PID include fever of 100.4 degrees Fahrenheit or higher, irregular periods, pain in the upper right abdomen, painful urination, pain during sex, vaginal discharge that may smell foul. PID can start suddenly. It can cause extreme pain and fever. This is often the case if PID is caused by an infection called gonorrhea. It is spread through sexual contact. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. PID is caused by various bacteria. A woman can get PID if bacteria infect her pelvic organs. The bacteria can enter the body through the vagina. The bacteria cause the organs to swell. This can lead to severe organ damage. Many different types of bacteria can cause PID, but most cases of PID are caused by gonorrhea or chlamydia. Gonorrhea and chlamydia are two types of STDs. STDs are sexually transmitted diseases. You can get an STD by having sexual contact with an infected person. It can take from a few days to a few months for PID to develop. The infection may take a while to travel up from the vagina to the other pelvic organs. You can get PID without having an STD. Normal bacteria found in the vagina and on the cervix can sometimes cause PID. No one is sure why this happens. Risk factors. There are certain factors that can increase the chances of getting a disease. These are known as risk factors. This section talks about risk factors for PID. You are more likely to get PID if you are under 25 years of age and are having sex, have had a sexually transmitted disease or STD, have more than one sex partner. Another risk factor for PID is douching. Douching is a way of washing out the vagina. Some women use it as a birth control method. Douching can push bacteria into the pelvic organs and cause infection. It can also hide the signs of an infection. Using an IUD for birth control may potentially increase the risk of getting PID during the first 3 weeks after insertion. An IUD stands for intrauterine device. After 3 weeks, the IUD poses little risk. Diagnosis. See a healthcare provider right away if you think you may have PID. He or she will perform a physical exam. This will include a pelvic exam. A pelvic exam checks the organs in the pelvis for signs of disease. During a pelvic exam, your healthcare provider will check for abnormal discharge from your vagina or cervix, lumps near your ovaries and fallopian tubes, tenderness or pain in your pelvic organs. Your doctor will also test you for STDs, such as gonorrhea. Your urine may also be tested to rule out a urinary tract infection. Your urine may also be tested to make sure you are not pregnant. Your healthcare provider may also use the following tests to diagnose PID. These tests can also rule out other causes of your symptoms. An ultrasound can help diagnose PID. This test uses sound waves to take pictures of the pelvic area. It can show abnormal changes in the pelvic organs. Another test that may be done is an endometrial biopsy. It is also called a uterine biopsy. For this test, a small sample of the lining of the uterus is removed. It is then tested for signs of disease. PID can also be diagnosed with a laparoscopy. A small, lighted tube is inserted through a cut in your stomach area. This tube allows the pelvic organs to be viewed. If you are diagnosed with PID, tell your sexual partner or partners to get tested. PID is spread through sexual contact. The bacteria can infect your partner without causing symptoms. Your partner may also have an STD. They may spread the infection to others. Treatment. PID can be cured with drugs called antibiotics. These drugs kill bacteria. Most people are treated with at least 2 antibiotics at one time. Your healthcare provider will decide the best treatment for you. You must take all of the medicine your healthcare provider gives you. Keep taking the medicine even if your symptoms go away. This helps to make sure your infection is gone. You should be seen 2 to 3 days after starting treatment. This is to make sure the antibiotics are working. PID can lead to severe problems if left untreated. Some of these include chronic or ongoing pelvic pain, ectopic pregnancy, infertility. Any damage done to your pelvic organs before you start treatment likely cannot be undone. Still, don't put off getting treatment. If you do, you may not be able to have children. If you think you may have PID, see a healthcare provider right away. Your healthcare provider may suggest going to a medical facility to treat your PID if you are pregnant, are very sick, don't respond to or cannot swallow pills, have an abscess or sore in a fallopian tube or ovary. You may need surgery if you still have symptoms or if the abscess doesn't go away after treatment. Problems caused by PID can be hard to treat, but they can get better after surgery. To protect yourself from getting PID again, encourage sex partners to get checked even if they do not have symptoms. Don't have sex with a partner who hasn't been checked. Avoid having sex until the infection has gone away in all partners. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Pelvic Inflammatory Disease is also known as PID. PID is an infection of the female reproductive organs. These organs are needed for a woman to have a baby. PID can lead to many problems, such as infertility. Infertility is when a woman is unable to have a baby. PID is one of the most common causes of infertility. The good news is that it can be prevented. Many women don't know they have PID because they don't have symptoms. For women who have them, symptoms can range from mild to severe. The most common symptom of PID is pain in your lower stomach area. A woman can get PID if bacteria move up from her vagina to her pelvic organs. Many different types of bacteria can cause PID, but most cases of PID are caused by gonorrhea or chlamydia. The bacteria that cause these infections can cause PID as well. PID can be cured with antibiotics. Any damage done to your pelvic organs before you start treatment likely cannot be undone. Do not put off getting treatment. If you do, you may not be able to have children. If you think that you may have PID, see a healthcare provider right away. Thank you for using Explain.